Hey guys, it's Sheila and welcome to Making It in Australia. For those of you who are new to my channel, I'm Sheila. I'm a registered nurse here in Australia and I have a new role as an emergency registered nurse, emergency department nurse, so ED nurse for short. And first and foremost, happy Emergency Nurses Week! Woo! I am so glad and so happy to be a part of this wonderful team. So before anything else, if you haven't watched my previous video, this is the scrub that I got from Figs. I know, I haven't ironed it, but it's so good. Looks so nice. And also I want you to look at my kicks. New kicks, new work shoes from Adidas, X James Bond, No Time to Die, 007. Oh my god. So yeah, that's my intro. Alright, our vlog is gonna be about the reasons why I am in love with ED at the moment. Because we're celebrating Emergency Nurses Week, I am gonna read to you guys the definition of emergency care according to the World Health Organization. Emergency care is an essential part of the health system and serves as the first point of contact for many around the world, especially when there are logistical or financial barriers to healthcare access. People may present for the care only when symptomatic with acute illness or injury. So that's just a really short term, but basically we provide emergent treatment to people in need, acute or non-acute trauma or non-trauma presentations. So when you go to ED, we treat everyone as much care as we can possibly, and life-saving treatments that we can provide. And so happy Emergency Nurses Week, everybody. Alright guys, so for today's vlog, we're gonna be talking about the 5 reasons why I'm in love with ED. Oh my gosh, if you haven't known already, I'm also a dialysis nurse. So I'm an ED nurse and a dialysis nurse and also ward nurse from time to time. So yeah, a lot of aspects in nursing. But here are the 5 reasons why I love emergency nursing. First reason, because of the diverse medical presentations that we go through every day. Oh my gosh, when I started working in ED, I realized that it doesn't only offer you one area of expertise, it offers you a lot of medical presentations. You will encounter patients who are geriatric patients, adult patients, pediatric patients. So from old, adult, and babies, you will have different patients that you will accommodate every day. And it's kind of exciting for me based on a new emergency nurse perspective. I'm not saying that I'm happy seeing patients, but I'm saying in a learning perspective, I'm so happy to be accommodating this kind of different demographics because I'm enjoying it. And it kind of relates to the second part or the second bit of why I love ED nursing. Alright, number 2 from my reasons why I love ED, it's because of the many clinical skills and learning that I'm accumulating at the moment. Oh my gosh, I can really feel that my brain is working, my clinical thinking skills is utilized every single day, every single shift, and I feel like I'm gaining more and more knowledge and more confidence in myself as a nurse looking after this diverse kind of people and patients that I've encountered every day. So it's kind of mind and body boosting as a nurse that you know what you're doing. So that really keeps me exciting. I'm so excited, and every time I try to be as positive and as healing or accommodating to my patients, because I know they're going through a lot, and mind you, the least I can do is just to alleviate their pain or to acknowledge that, you know, they need us or they need help. So yeah, it's a really good area for you to learn, and I encourage you to try ED. For those of you watching who haven't been to the emergency department and you're a nurse, go try it. It's not for everybody, but just give it a go. I hope you love it as much as I do. Now, moving on to the third reason. Oh, hi! There you are. Hi, Baba. Nice for you to join us. All right, down to my reason number 3 why I'm so in love with ED nursing at the moment. You're right. This is my Wonder Woman cup because I'm working with superheroes. To be honest, I'm working with a highly skilled senior nurses, ED nurses. We've got our clinical managers. Our managers are really looking after us, and supervisors, our team leaders are really onto our well-being. They're making sure that we get our breaks. And you know what, guys? I see now why they're called like frontliners and superheroes, because they really kick ass. Sorry for the term. That are really highly skilled, they are well trained, and also their clinical thinking skills are so mind-blowing. You'll realize that, you know, they've really trained to be an ED, and yeah, that's what I said, it's not for everybody, but you see these nurses and they just work through a shift like it's nothing. It's like smooth sailing every time they're on shift. So yeah, I'm so amazed, and they're very knowledgeable and very efficient. And also, alongside those, I'm working with really great doctors. I can say that my experience here working with the doctors are amazing, because you know, you're collaborative, you're a team, and you guys are talking to each other, making sure that, you know, you have the best goal for your patient. The ED nurses that I'm working with at the moment, they're really badasses, and I want to be one day. Down to number 4. I love the rush. The rush that, you know, when you see a patient, you are keen on delivering the most effective care at the best moment, the best possible time, because you know they're going to a rough patch in their life, they're going through something in their medical health, and it's kind of hard, especially for patients that are really vulnerable, like old people, pediatric patients. So you want to deliver the most effective care, and so there's the rush, there's the adrenaline that, you know, you just keep on going, you just go, and that's the most amazing part, because so far as what I've experienced with treatment and nursing care, 15-minute, 30-minute, or an hour of effective care makes a long way, and it helps a lot of patients. And I'm so amazed of what we're doing, that we're saving lives, and just so amazing for me. I want that high. I'm so in love with the high that I'm able to do. Down to the 5th reason why I love emergency nursing. It's because it fits my character. My character is a resilient, happy, and flexible nurse that I want to be on the go all the time. And I think it works for me, being able to do something. I don't want to be sitting around and not do anything. And as far as I know, what I'm doing is changing or making a difference in people's lives, especially their welfare and health. So I'm so happy to do it. And sorry, here is really sleepy. I love you, Baba. And my temperament is one of, you know, being very on the go. And also, I've seen so many nurses that are fun to work with. So we try to squeeze in a bit of fun while at work because you know life is short. We should be happy. We should actually love what we're doing and well, you know, when working. So yeah. Alright guys, that's the 5 reasons why I love emergency nursing. And so again, happy Emergency Nurses Week and happy Emergency Nurses Day to every emergency kick-ass nurses there, and also those healthcare or allied health that are working in the emergency department. You guys are amazing. I salute you. Hands down. You're doing 100%. You're doing really great. Tap yourself in the back because you guys are awesome. Alright, it's Sheila reminding you to inspire like wildfire, dream big dreams, and maybe one day you too can be an emergency nurse here in Australia or maybe anywhere. Bye guys, I love you all. Mwah. Alright guys, amongst these 5 reasons, there are only 5 reasons that I've given you, but the most important thing for me is for you to love your job. Whichever part of nursing that you're doing, may it be emergency nursing, theater nursing, or ward nursing, or medical nursing, medical surgical nursing, the most important thing is to give it your all, give it your best shot, give your patients 100% of care, and of course to love your job. And if you start loving your job, it'll make you feel more happy and more contented. You'll be more satisfied with yourself. You gain this self-actualization and self-confidence that you know you're doing the best that you can for everyone around you. So alright guys, that's it. I love you all. Mwah.